So there's a variety of things that actually impact whether someone's actually qualifies for automatic renewal. Just to give you an indication of where we stand this year. So last year, when folks were getting ready to enroll into a 2017 plan, the customer base, or the proportion of the customer base that was eligible for automatic renewals was roughly 65%. This year, we've got that number up to about 86%. So that's actually that's a big increase. It's an important increase because we do know that the folks who do automatically renew, oftentimes the retention rate for those customers and the customer experience for those customers is much greater. So just a couple of stats to share from the prior year. So what we do know is from last year, for customers who did renew, about 34% of those customers actually selected a different plan than the prior year. So this gives us an indication of how many customers actually come in and just essentially saying, you know what, I like my plan, I want to pick the same one, versus folks who are actually going into the system and actually doing some comparison across plans and evaluating if maybe the plan that they had in the prior year was good for them, or if there's a better alternative out there. And as you can see, I mean, as you look at the actual the columns here, these are split out by their financial assistance categories. So whether they were qualifying for advanced premium tax credit only, or the advanced premium tax credit with cost sharing reductions, or no FA, which indicates that the individuals didn't qualify for any assistance. And as you'll see, I mean, the folks who traditionally receive less financial assistance or no financial assistance are traditionally more likely and more often shopping around for a plan, at 46% of those who don't even receive financial assistance shopping versus 23.9% of those who are receiving more financial assistance. In addition to that, one of the things that we do know is that price is the most important factor for our customers. Obviously, and that makes sense. When folks are looking at plans, the plan designs are important, the benefits and the coverage is important, whether they're doctors or a network are important, but the number one thing that they're really focusing on, based on our research and our surveys with them, is price. So given the impact on pricing this year, I think it's important just to keep in mind that we've got a couple of things impacting the premiums this year. Well, the first thing is each year there are a rate filing by the carriers through the insurance department within the state. And traditionally, that's just going to be the insurer essentially requesting a rate decrease or an increase. Another factor that goes into it is the customer's rating factor. So that's going to be the county you live in as well as your age. And unfortunately, we're all getting older. So each year, folks are going to have a little bit of a lift from an age perspective. In addition to that, the plans that customers pick, as you might expect, have an impact on what their price might be between 2017 and 2018, and what that impact might be from a pricing perspective. And then lastly, one of the biggest impacts is going to be, are they eligible for financial assistance? So keeping that in mind, as folks come into our portal for picking 2018 plans this year, they're gonna notice a few things. Number one is they're gonna see a difference in plans that were available last year to this year, as well as they're gonna notice that there's a change in pricing. As we look back at prior years, one of the things that I think is important to keep in mind is what was the trend in plan selection that we saw from our customer base. So for that 34% of customers who actually did select a different type of plan, what we found was that about 67% of them picked a plan that was in the same metal tier. So essentially, they picked a plan that was equivalent. It was in the same metal tier, so you can imagine the benefits are somewhat similar. But for the difference there, I mean, what you're seeing here is about 25% selected a plan in a lower tier. So what we know from last year is that there's a general trend in folks coming into our site, having a plan, and then as they go and search around for a new plan for the next year, what they're doing is they're essentially picking a plan in the lower metal tier, which is usually a strong indication that they're being price sensitive. So we've seen that this year, and my gut tells me we're going to see something similar this year as we go from 2017 to 2018. In addition to that, one of the things that we wanted to do is we also looked at how many folks, or what the actual premium change perspective or view was from 2016 to 2017. So last year, what we found was a gross majority of our customers, about 55% of them, experienced about a $1 to $2 premium increase if they were receiving a CSR. And that was 55% was that group that was receiving an APTC or eligible for an APTC and CSR. About 17.6% of them were folks that were eligible for just an APTC, and they observed about a $5 increase in their premium. And then for those who were not eligible for any kind of financial assistance, that was about 14.6% of the population. Essentially, they observed about a $90 increase. And then what you'll see on the right side is the folks who actually moved between financial assistance levels. So once you move across a financial assistance level, then at that point, as you might expect, your premiums are going to shrink or increase at a much higher rate. So we've got a couple of examples of what that impact is if you were to essentially move up a level and gain an advanced premium tax credit or lose it. So we just wanted to highlight that and kind of give an idea of how much that premium can fluctuate depending on your eligibility for financial assistance. In addition to that, this year, one of the dynamics that we are going to see, as I mentioned a little bit earlier, is the impact of individuals who are enrolled in silver plans, and more importantly, the concept of if you're eligible for a financial assistance, that's usually going to insulate you from premium increase, strictly because of the calculation on how advanced premium tax credits are calculated, versus those who are not receiving financial assistance or are not eligible for it. They lose that layer of insulation of having that advanced premium tax credit. So in other words, what we did was we put a very high level example together here. So we have Jane Doe. She lives in Fairfield County. She's enrolled in a standard silver plan in 2017. She's planning on re-enrolling in the same standard plan or the same standard silver plan in 2018. And there's just a couple of other details around Jane. She's 46. Her income, let's say, is going to remain exactly the same between 2017 and 2018. And in this particular example, just to make the math and comparison easy, let's just assume that Jane's going to remain 46 between 2017 and 2018. So in other words, what we did here, though, is we looked at this table, is we split it across 3 different levels. In one scenario, in that bluish color, Jane makes $80,000 a year, and that puts her above the 400% FPL threshold. So that would mean that she's not eligible for any kind of financial assistance. The second scenario, she makes $36,000, and that puts her roughly 300% FPL, and that would qualify for her for an APTC. And the third scenario, she makes about $22,500, and that puts her at about 185% FPL level, and that would mean that she's eligible for not only an APTC but a cost sharing reduction as well. So as you go down these different paths, you'll start to see what the impact is from a pricing perspective from 2017 to 2018. So starting off with the unsubsidized or the bluish column here. So this is the scenario where Jane is essentially not eligible for an APTC. As we look at her premium, her monthly plan premium for this particular plan is about $697. She's not eligible for an APTC. And she's going to be paying, or she's going to be obligated to pay $697 for that particular plan per month. And that's about a 32% change from last year. So that's a significant impact to her. For the scenario where Jane is at the 300% FPL and she's essentially qualifying for an APTC, you'll see that her plan still is $697 from a premium perspective, but she is eligible for a $407 monthly advanced premium tax credit. So what that means is in terms of the price change from 2017 to 2018, she'd actually observe about a 2% decrease in her price just because of the way the APTC calculation worked out. And then in the last scenario, again, she's actually seeing a little bit of a price decrease. Her plan from 2017 to 2018 dropped about $6 in her actual obligated amount that she needs to pay, her after APTC premium. So this gives you at least a high-level view of some of the disparate experiences that our customers are going to see as they come in and look at plans and shop for new plans, particularly if they were enrolled in 2017 and have that price threshold in their head. So one of the things we wanted to do this year was we wanted to make sure that we were doing everything we could to make the shopping experience as smooth as possible for our customers. But more importantly, as customers come in and evaluate plans, we wanted to make sure that we were giving them tools that were going to facilitate the plan comparison process. So about 2 years ago, we released something called the Consumer Decision Support Tool, and the main focus of that tool was to help folks predict or at least simulate what their medical expenses would be, and then that would overlay what those medical expenses would look like compared to the plan benefit design that they were looking at for plans on the exchange, and that would help give them an idea of what their net cost would be for that plan for the year. What we wanted to do, obviously, was improve on that tool. So what we did was we first took a step back and said, let's take a look at, where our pain points are for our customers as they go through the plan shopping process. And what we found was some interesting findings. So 1 in 5 customers indicated they experienced problems while they were trying to find and choose a plan last year. About 1 in 10 thought the shopping process took too long. About 1 in 4 were struggling to determine which services were covered and what the cost of those services would be. And then 1 in 3 had trouble determining whether their plan actually covered the physician or the provider that they wanted to have included in that plan's network, as well as they were having trouble figuring out whether a prescription drug they were taking was included in that particular plan's formulary. So with that said, we started, as we started essentially revamping this tool, we started looking at the landscape, and we kind of put out some core principles out there. The first thing is we wanted to make sure that version 2 was going to be health literate. We wanted a simplified user experience, and we wanted to really provide customers with a non-cluttered, sensitive site that understands that usually customers are only doing this once a year, so we really need to make health literacy something that is a forefront issue. Second thing is we wanted to make sure that we were at least being cognizant of the difference between plan premium and plan cost. The plan cost being the incorporation of the out-of-pocket exposure of utilizing that plan. We wanted to make sure we were actually being transparent in terms of how those costs are displayed to our customers. The third thing we wanted to do is we wanted to make sure that we incorporated that desire to see whether a provider was in network or not. We also wanted to incorporate whether a prescription drug was in formulary or not. So we made that a requirement for the version 2.0 tool. We wanted to make sure that our customers understood that if they look at an HMO versus a PPO, that they understood the distinctions of those plans. And then lastly, we wanted to incorporate an easy comparison of those plans, whether it be the quality of the plan, the carriers offering the plans, or the services included. So with all of that said, what we wanted to do was give a demonstration of the new tool and show everyone what that essentially looks like. From a technology roadmap perspective, this tool is something that is still segmented from the main application process. What we're doing from a roadmap perspective is, first thing we did was version 1, and we kind of just started getting customer feedback on where the tool was deficient. Version 2, which is what you're looking at now, includes a variety of new features, which I'll be covering shortly. And then the third thing is once we get a second wave of feedback on this tool, we'll then be working towards incorporating it into our application process, so the consumers, hopefully next year, will see a completely seamless process where these questions and the functionality are completely built in. So with that said, if everyone can see my screen, what I have here is the Access Health website. And if you're a customer coming in for 2018 shopping, you will see a plan comparison tool window here. What this will do is bring our customers out to the actual tool that we were just discussing. There'll be a short disclaimer. And at that point, what we're offering up here is this is essentially similar to the anonymous browsing experience. The goal here is to essentially give customers the quickest and most efficient way for them to enter the core variables needed to determine whether they qualify for financial assistance, whether they qualify for a Medicaid plan, and then also to kind of essentially start triaging through a plan selection process and collecting the information needed to essentially display the plans in an effective way. So in this particular demo, what we're doing here is we're going to add in some information here on this particular individual's application. So essentially what we're doing here is run through some information. So this individual lives in Hartford. They're roughly 30 years of age. It's a single person household.
And let me just, we've got a lot of so I'm going to bring up the participant list and see if we can mute.
Okay. I think the echo is gone. So what we're going to do is we're going to actually put in the annual tax income. One of the things that's important to call out on the site is what we wanted to do is we wanted to make sure that as folks flow through the site, that everything is pop-up enabled. So in other words, as you look at terms that may not necessarily be intuitive to a customer, that they have the hover over feature, which all definitions then will be included on these hover over features. In addition to that, the site is also available in Spanish, and we also have dynamic linking into the main Access Health application site. So with this particular scenario in mind, I'm going to fix the date of birth there. And we're going to check for the eligibility for financial assistance. In this particular scenario, the individual is given or is determined eligible for a $237 per month advanced premium tax credit, as well as there's an indication here that they would be eligible for cost sharing reductions as well. As we continue through the experience, what you'll see is essentially the next 5 questions, which these are the core questions that are asked to essentially start providing information on the display of the plans in hopes of providing a comprehensive view of the variables that a customer would need to essentially evaluate the plans effectively. So one of the things we've done is we've transitioned from last year's tool to a more simplified view of what their healthcare needs would be. In the past, what we would do is ask for specific conditions and anticipated surgeries. This year, we tried to simplify it as much as possible, and what we're doing is we're just asking relative questions. So in other words, please describe the medical services you expect to use in 2018, and we've categorized them from low to very high, and then provided examples in terms of how you could define low or very high use. So we're going to leave this as medium use for medical services. In this particular scenario, we also follow a similar format for their usage of prescription drugs. So in this particular scenario, what we're going to do is we're actually going to say very high usage. And we know the plan designs are usually structured in a way that they have different formularies and different co-pays depending on medical services and pharmacy usage. So there's some intent here in terms of breaking out medical and pharmacy usage, and there's some thought behind that. So with that said, what we've done is we've entered into 2 pieces of information for medical utilization or anticipated medical utilization. And now we're going into essentially some questions on which providers the individual would want included in their plans, or at least an assessment of whether that provider is in network. So what I'm going to do is I'm going to add actually 2 providers to this. So we have one scenario here, we're going to add Dr. Hauser, and the second one, we're going to add a primary care physician. And the second thing we're going to do is we're going to then move on to the next screen where we can actually enter what type of prescription drugs we'd like to assess are covered by the different plans. So we're going to enter in Lipitor, which is just a common drug out there, and we should get some good feedbacks there. One of the things I would call out here is Lipitor. Obviously, it's a common drug. A lot of folks recognize the name from the advertisements, et cetera. So Lipitor is a brand name drug, but this tool also will bring back the generic form of that drug. And as we look at the plans, there'll be indications on whether the brand name is covered. And if the brand name is covered, they'll also bring back pricing information or copay information on what the difference would be between going through for the brand name versus the generic. There'll also be an indication of whether just the generic is covered and the brand name is not. So you'll see what that looks like in the next screen. So what we've hit now is essentially the plan comparison screen. What this will do is a couple things I'd like to call out here. So this is going to start lining up all of the plans that are available through the exchange for this individual. What it is sorted by right now is the total expense estimate. So that's not just the plan premium, but that's also incorporates the anticipated out-of-pocket utilization or expense, so the actual total expense of the plan. Since this individual was eligible for a CSR, we've actually automatically filtered out all plans to just those that are eligible for CSRs. And our hopes here are that folks that are CSR eligible will kind of recognize what that term means and physically uncheck the box on that one. We want to make sure that we're steering our customers to the plans that are appropriate for them, at least from a financial assistance perspective. In addition to that, the plan types, if for example, having the ability to go out of network is important for a customer, they may want to filter out HMOs. So we've added essentially a variety of filters there to help customers through the process. In addition to that, the ability to filter out metal tiers, there's deductibles as well as carriers. As we look at the plans that are aligning here, I just want to call out some of the things that appear in these summary tiles. So here what you're going to see is the lineup of plans that are essentially sorted by that total expense. You'll have your estimated monthly premium, an indication of what your out-of-pocket expense would be for primary care visits and essentially tier 1 drugs on your formulary, an indication of what your yearly deductible would be and your out-of-pocket maximum. And then we start getting into the components that are essentially driven by those questions that were asked in the prior screens. So your total expense estimate is essentially what we've done is we've tried to stay away from numbers and complex descriptions of what that might be. We simply just have 3 categories: low, medium, high, and they're indicated with essentially color-coded flags as well in terms of trying to simplify what that actually looks like to the customer. In addition to that, we have the NCQA quality ratings for the plan, and then essentially those drugs and providers that we had included. So in this particular scenario, what we had done is we had included Lipitor, and you'll have summary tile descriptions of whether or not that drug is included by the plan. So for example, Lipitor is covered by the Silver Standard POS plan. However, only the generic format is covered by the Silver PPO Standard Pathway plan. And in addition to that, we have our two providers that we entered here. So you'll see here that Dr. Hauser was out of network and not included in this plan's network. However, Dr. Regenio is. So again, if you're a customer and you're going through this process, a very quick view of potentially how you're going to filter plans in or out depending on what your needs and your desires are for that particular plan. In addition to that, there's the ability to compare plans across the board and drill down into plans to actually see the detail of those plans. So again, we had seen the summary tile information, and for the most part, a lot of it is very similar to the summary tile. So you'll see your copays after deductible for both the brand and the generic. But as you scroll down, you'll also start getting more information around the services covered by that plan, what their copays or out-of-pocket exposure might be from a deductible co-insurance perspective. And essentially just some high-level views of the different services that would be covered by that plan. You know, one of the things we always recommend to customers is if they're using this tool, I think it's always important to keep in mind that, you know, this is a technology-driven tool. It's going to be accurate 90–95% of the time, but it's always important to lead our customers back to the carrier's summary of benefits and their detailed plan documents to ensure that once they actually find the plan that fits their needs, that they go back to the carrier documentation and just confirm everything that is important to them from a provider network or formulary perspective. In the event that a customer has looked through the plans and they've actually picked the plan that they like, the customer experience now would be that they will redirect them back to the main site. They can enter their credentials and essentially access their application from last year and then start the renewal process into 2018. In the event that they're coming in for the first time, we'll essentially link them to the site so that they can create an account. And at that point, they'll essentially you know, be off to the races to essentially get coverage for 2018. So with that said, this is essentially a high-level overview of that plan comparison tool. This isn't we're making iterative improvements to it, and our hopes are that next year we'll do another demo here and show some additional improvements made to it. And again, the focus here is to continue to provide a better experience to our customers. So we're looking forward to that. With that, I'll pause for any questions.
Thank you, Rob. Thank you, Rob. Thanks, Rob. I want to open it up to questions to the team that's on the call. I know we had a few more people join us from the beginning of the call. If there are any questions, you can drop them into the chat box now. Also, I can unmute everybody, and you can raise your hand, and we'll go that way. So, are there any questions out there for Rob's presentation? Everyone should be unmuted. And in addition, if you have muted yourself, you have to unmute yourself before we're able to hear you. All right, Rob, I guess I have one question here. What would you say the tool from a utilization standpoint, how can CACs and brokers, in addition to consumers who are coming in to enroll or find out questions about their plans, how do you foresee those individuals being able to utilize this tool to help them with their work and their business?
Yeah, that's a good question, Lee. So I think the tool is not intended to replace brokers or CACs or any kind of assisters out there. I mean, the tool is essentially intended to make the process quicker and easier for everyone that's essentially utilizing the system. So if you think about it from a CAC perspective or from a broker perspective, if you've got a new client coming in or a client who's essentially saying, hey, look, I'm currently enrolled or I'm looking to enroll, the goal here is to help them have a conversation with that client and essentially quickly determine what, at a very high level, roughly what they're eligible for. And then at that point, be able to give them an effective comparison. So really, it's just as much a tool for consumers as it is for the assisters out there. But I think the important thing to keep in mind is as the assisters are using these tools, this tool is meant to be essentially a high-level depiction of something that's extremely complex, the plan shopping experience, or the plan assessment and the selection of a plan and evaluating whether it fits a customer's need is extremely complex. So having that in-person assistance, having someone to chat with, that's still something that's a core requirement of this. So I hope that answered your question, Lee. I mean, ultimately, it's supposed to be a tool to help folks with this process, whether they're sister or a customer.
I think that's great. A couple more questions here. First, just to clarify, where can individuals access the tool? Where do they have to go on the Access Health website? If you want to maybe show that your screen is still shared. So
yeah, sure.
If you want to show them exactly where it is, I know we have a lot of information for our partners on our Access Health main page.
Yeah, so when folks access the main Access Health Connecticut webpage, what they'll see is essentially the main site here, and I think everyone can still see my screen. But you'll then get the carousel on the bottom. So the plan comparison tool is a direct link to the tool that's out there. So essentially when you click to it, it's going to bring you out to that external tool that's going to help folks with that process. When you reach the end of the process, it'll redirect you to the main site again, but to the applicable screens to either enroll, access your existing application, or find assistance in the community.
Great. Hopefully that answers Harry's question. So if that wasn't full enough, go ahead and type in a new question. I'll get that answered. Another question for folks: what kind of improvements or updates are you foreseeing being instituted in the tool in the coming months or year?
Yeah, so I think first and foremost, we've got to get this tool from a technology road mapping perspective. We've got to get this tool incorporated into the main application. Having an external tool is not ideal. But again, what we wanted to do is, I mean, there's big investments that go into these systems, and we wanted to essentially take a lightweight approach to it, be able to evaluate and assess customer feedback before we do the full investment of building it to the full application. So first and foremost, we need to make the experience seamless and integrated. I think the second thing, though, is we're in the midst of open enrollment. What we're going to be doing is we're going to be surveying customers who've used the tool to, once again, similar to what we did in past years, assess where their pain points were and assess what their core requests are going to be for future year improvements. So really, I hear what you're asking here. I think that's an important question. I think we know from a customer experience perspective how we want to integrate it, but we're going to let the customers drive us to where they want improvements, and that evaluation is going to happen within about the next month or so. So I'm excited to see what we're going to find from that.
Great.
Hello.
If there are any other questions, please go ahead and either type them into the chat box or your audio is unmuted, so you can go ahead and ask the question over the phone if you so choose.
Hello, can you hear me by chance? I'm on my iPad.
Yep, we can hear you. Go ahead.
Okay. Yes, I'm a broker. I happen to be a broker. I noticed one of the things, and it's been an issue for me, on the front end of this program where you input your information. Last year you had a similar program as well, but it filtered out, if you were a non-resident or you weren't eligible for Husky because you're, a non-immigrant within the 5-year period. That portion of the tool has been dismantled, so it doesn't, you get a false, skewed results when you go into this plan. To me, it's been very problematic. I have a lot of, foreigners that apply. For instance, if you have someone that doesn't qualify for Husky because they haven't been here 5 years, if you can't seem to put them into the plan so that it determines that they aren't eligible, if you follow me. Last year there was a selection that have you been here 5 years, and it automatically compensated for that. The same applies to, I have a family where one of the children in the family, it's a mother and her son. The son already has insurance through another medium, and you can't input that information to get a true reading on the plan results, if you follow me, because you either put in 2 people, which is not the case, that require the insurance, or you put in the 1 person, but it doesn't account for the person that needs. There's 2 people in the family structure, so the results on the next screen are inaccurate. It's been
I think we understand your problem.
Yeah, no, we fully understand. We understand where you're going. So I mean, so one of the things as we roll these tools out, what we do is we traditionally follow the design that's in the anonymous browsing within the main website. We didn't build the tool out with the anticipation that it would be the full system for determining eligibility in the full-blown manner in which you can test for 5-year bar and you can see different types of income and what's included versus not for determination of APTCs, et cetera. That process takes quite a while. It's a multi-step process. Our focus on this one was to make it as simple and fast as possible for someone to get from step A to step Z and essentially get a high-level eligibility determination. One of the things we're doing, though, is we're always redirecting individuals back to the main site for the full official determination of eligibility. In terms of the 5-year bar question and how it was included in the prior tool but not included this year, that is something I hear your pain on that. That question in general is something I understand that's very important, particularly if you're dealing with a population where that's often a significant question, right? That's a super important question for you. I hear you. It's something that's on our roadmap, and if we can get this built into the full application, it becomes a moot issue. But understanding that we're kind of developing this thing iteratively and improving on it iteratively, it's just something that we couldn't quite fit into the development plan for this open enrollment this year. But we're certainly taking it back internally, and it's something we'd like to see improved on in future years.
Well, yeah, and not to belabor the issue here, but again, it was part of that functioning last year. So whether you were Eskimo, Indian, or whatever, those questions were there. So I mean, it seems to me that they've been taken out to no particular advantage for me at least, or those. Because at the end of the result, if you go through this and you're assuming you're going to have a certain eligibility determination, it's going to be skewed or wrong. So, maybe it serves 90% of the people and the other 10% just, get the wrong results or somewhat misled, I guess, is a better way of putting it. Seemingly that you had something that.
I hear your concern. Yeah, I can tell you that we didn't make that decision lightly. It was not as though we made it voluntarily. As we rolled the product out and we were running against a tight timeline, it was one of those things where, we didn't want to put the full functionality of the tool at risk for potentially 5% or less than 5% of the user base. So again, those are one of the things where we had to unfortunately make a call on it. It's not in a perfect world we'd have all that functionality built in, but unfortunately, it's one of those decisions where as you're kind of rolling out a new product and you're running against a tight timeline, you have to make sometimes difficult decisions. But I hear you loud and clear. So, like I said earlier, our next step is to essentially integrate this so that there's no discrepancy between the two experiences. So I appreciate the feedback, and then we'll bring it back internally.
Thanks, Frederick, for a question. Appreciate that.
Okay.
Are there any other questions from the group? While you're contemplating any last-minute questions, we'll begin to close out here in a few minutes. But make sure that you take an opportunity to fill out the quick survey. It's found in the chat box. It's a SurveyMonkey link. It'll help us greatly to improve these as we go forward in our webinar series. If there are any other questions, I'm going to move on. If there are not any other questions, I'm going to move on to closing out our presentation here. But I do want to cover a couple things before we do that. I know that some of you who are online here are brokers, and some of you are CACs or other community partners. And we want to make sure that we make you aware of opportunities to partner with us at Access Health. In terms of a community partner, most of you know that there are often community health centers, community organizations that serve a social service or community neighborhood function. We also partner with educational institutions when we visit community colleges and the University of Connecticut in particular. We've had a long partnership with them to ensure that people are aware of Access Health. But these are examples of the types of community partners that we work with, and we ask them to share information about Access Health's open enrollment period and the special enrollment period following OE. And those individuals do a great service at providing information to their constituents and to their consumers. We have a ton of partners across the state. If there are places that you visit every day or any type of organizations that you're a part of that you think it would be helpful for us to connect with so that they have the most up-to-date information about enrolling in healthcare in Connecticut, please let us know. There's always a place or organization or individual that we haven't spoken with. We're not perfect, so we always ask that you provide us that feedback. And we will make people available to come to events, train, and host informational sessions for the staff, especially those entities that deal with the public at large in areas that share a mission with Access Health's mission, which is to eliminate the number of individuals in the state who don't have insurance, and also to reduce health disparities and get people just living a healthier life. So there's plenty of opportunities to partner. There's 2 resources I want to point to for those community partners that are on the call, or non-brokers, I would say, and I'll have a resource for you in a moment. But for those who are CACs or partners, you can visit learn.accesshealthct.com/community, and that offers information about events that we're participating in. It links to our monthly newsletter. You can sign up for our monthly newsletter, and you can also print and download educational materials from the website. There's also a resource with that same link, except /brokers, and there's other materials that you guys can utilize to speak with your clients as well. Just want to let you know, again, we can engage with the community by doing speaking engagements. We often have something called an outreach tour where you may see us at events, fairs, and festivals. I mentioned the webinars that we're doing like this one, and other informational materials that you can access from the Learn website. If you need to contact us or want to contact us, you can at that outreach email, outreach@accesshealthct.com. And these are just examples of a couple of the resources that we have available online. And I definitely encourage you to sign up for our monthly newsletter if you have not already. The last thing I'll leave you with is we have a couple upcoming webinars that will cover additional topics that are related to supporting CACs and brokers in their engagement with the public and the community. We will have one in our membership, and we will have one on special enrollment. We'll have an additional one on open enrollment, and we'll have another one on the 1095 process and any FAQs that you have about that. Look for those webinars to occur in the month of January and early February. If you have suggestions for topics or other areas that we should address, we definitely want to hear from you on that. All right, I don't see any additional questions. I'll put it out there going once, going twice. All right. I want to thank Rob Blundo for joining us today and giving a presentation on the where we are with our membership, what those individuals are signing up for, as well as the tool and where Access Health is going in order to provide more resources for brokers, CACs, and individual customers who are signing up for health insurance. So I also want to thank everybody for joining this call. And if you have any other questions, you can feel free to contact us at the outreach email that I indicated earlier, outreach@accesshealthct.com, and we will forward your question to the right person. Thank you, Rob.
My pleasure.
Have a great day, everyone.